right, bear with me while we get through this because my husband snored so loudly last night. It was crazy. And it was very disruptive to not only me, but I'm sure himself. I would consider his snoring to be kind of dangerous, actually. He seems to have what is called obstructive sleep apnea, and it's caused mainly by the relaxation of your nasal cavity and stuff inside your body that blocks your airway. Um, Signs of obstructive sleep apnea could be snoring, extreme fatigue, um, elevated blood pressure, symptoms. Again, the blood pressure, the fatigue. That's something that affects people on the daily, and it not only affects him, but obviously affects me as well. I guess testing and treatment as well for obstructive sleep apnea would be there are tests that we can do. You can do at home. If you can't get a good one with that, there are tests you can do through clinics. They have sleep apnea clinics specifically for this reason because sleep apnea is not something that we should all kind of dilly-dally around with. Getting tested and treated for sleep apnea could not only change that person's specifically life, but even their loved one. And, as much as I love my husband, when he snores like that, I just want to grab a pillow and just, how much do you value your sleep? That's kind of a big question here. It's how much do I value my sleep as well as his? He works hard, and listening to him kind of complain about how fatigued he is or how tired he is, and it could be just something as simple as being tested. And being tested for those kind of things, again, are simple of, at-home tests or in-clinic testing. The devices used for treatment of those, there's a couple different kinds. Severe sleep apnea could just be surgery. Nobody obviously wants to go that far. So there are things called like a CPAP machine, which is short, or it's an abbreviation for a continued positive airway pressure machine. Or there's a BiPAP, which is also, it's like kind of a type of ventilator that people use when they're sleeping. It doesn't seem the most comfortable, but the benefits are, I would hope, outweigh the consequences of not using it. So when I was looking up stuff about obstructive sleep apnea, I found a lot of good things about signs and symptoms on mayoclinic.com. Very good. Talks about, again, the headaches, elevated blood pressure, increased likely that you'd have even diabetes just from not being treated for sleep apnea. CPAP, all that kind of stuff. You can find a lot of information about that online, as well as in books, just medical history. But one that I found was really, really important to me and that I found was really helpful was healthline.com. Of course, everything's on the internet these days, and sometimes you can a lot of things aren't as credible, but they did seem to find a lot of stuff about treatment as well as the devices used. Those devices can get a little complicated. You have to put water in them to keep you from drying out, so you're not having nosebleeds and all that, and kind of making things worse. So healthline.com was really helpful in understanding the treatment and the devices used for sleep apnea. And presenting this to my husband, he was like, I'm not wearing that on my face. But they do have other types of tests to help you with, the type of devices to be used. There's not only the full face masks, but there's nasal pillows, just goes over your nose, stuff like that would help, that you can kind of adjust. Why does all this matter? So, improved sleep, okay? Improved your life. I mean, it's clinically proven that the better sleep that you get, the better life, the better attitude you have. You're less tired, lower blood pressure, lower risk of diabetes is great. Things that you can do otherwise besides surgery and stuff like that I found on sleepfoundation.org was that simply losing weight actually. Sleep apnea can help or can gain weight because you are so fatigued and you don't have that energy to maybe even make a healthy meal, something like that. And losing weight can be a huge factor in treatment of sleep apnea or, the cause of sleep apnea. So, again, the signs and symptoms like snoring, fatigue, and the diagnosis, getting tested, doing the at-home, it's called an oximeter test, a oxygen test that they can do at home. And then if it goes that far, obviously surgery, we don't want to go that far, but that is something that the help, the sleepfoundation.org did talk about, and how the surgery kind of consists and stuff. So I really hope that, you guys, if you know anybody who does snore or know a loved one that is being affected by this, that you do have them get tested or treated, and, we can see the benefits. And maybe, again, it might not even save your life, but maybe a loved one, because it stops you from committing murder. So just sleep in general is so important. And just knowing the benefits and the signs and symptoms and how to get treated or when to call your doctor is something that a lot of people don't talk about. And I hope that if you do know somebody or have a loved one or even yourself have these issues, that you do take the time to call your doctor and, again, possibly just live a better life and, sleep better. So thank you very much.